Welcome to all. Let us talk about conversion of ordinary oral contraceptive to emergency contraception pill. Combination of estrogen and progestin selected for the emergency pill because it is an ordinary controlled pill. Each dose must contain estrogen 100 to 120 microgram and progestin 0.50 to 0.60 milligram. Combination of estrogen and progestin work by preventing ovulation, changing the lining of uterus to prevent pregnancy, also prevent the sperm to enter cervix by changing mucus at the cervix. We need estrogen 100 to 120 microgram. We can select ethinyl estradiol. It is a form of estrogen 100 to 120 microgram. Then select progestin 0.50 to 0.60 milligram. Select levonorgestrel 0.50 to 0.60 milligram or norgestrel. Next one, collection of pills. We can select Diane 35 tablet. Diane 35 tablet contain cyproterone and ethinyl estradiol. It contains ethinyl estradiol 0.035 milligram. We required 100 to 120 microgram of ethinyl estradiol. So we can convert 0.035 milligram to microgram. It becomes 35 microgram. So we can multiply with 4 into 35 micrograms equal to 140 microgram. So take 4 tablets of Diane 35 from the middle portion only. Next one is Serracet tab. It is also ordinary contraceptive pill. It contains desogestrel. It is a progestin. We required progestin 0.50 to 0.60 milligram. Serracet tab contained desogestrel 0.075 milligram. Multiplying with 7, we will get 0.52 milligram. So take 7 tablets of Serracet from the middle portion. How to use these tablets? Take an anti-emetic medication and wait for 30 minutes to prevent nausea and vomiting. Then take 10 to 11 tablets as a single dose. 4 tablets from Diane 35 and 7 tablets from Serracet. Take the tablets from the middle portion of the strip. Repeat the same dose after 12 hours. Side effect is more depend upon the other methods. Thank you for watching.